Welcome to another video where we're discussing interpupillary distance measurement. In the previous video, I showed you how to measure the binocular interpupillary distance. In this video, we're going to be measuring the monocular interpupillary distance. The monocular interpupillary distance measurement is very important, especially when you're ordering progressive lenses, aspheric lenses, or high index lenses. Remember that some of your patients don't have symmetrical facial features. There are some patients who, for instance, their right eye is more nasal than the left eye. So if you don't measure the monocular pupillary distance for your patients, that means you're going to be inducing unwanted prismatic effects, and you wouldn't want that for your patients. Remember that high index lenses can cause chromatic aberration. So if you don't get your monocular PD right, this effect of chromatic aberration is going to be more pronounced for your patient. So in everything that you're going to do in practice, always make sure you get your pupillary distance measurements right. So let's get right into it and let's measure my patient's monocular PD. For monocular PD measurements, I can either do it with my patient wearing her pair of glasses or without her pair of glasses. So let's measure it with my patient wearing her pair of glasses, and then I'll show you the other method. Let's do that together. Make sure your patient's head is properly aligned and not tilted to one side. I already know where my patient's pupil centers are, but if I want to be really sure, I can use my pen light so I can work with the reflex. I'm still seated 40 cm away from my patient. So I close my right eye and tell my patient to look at my left eye. I dot the center of the pupil. And then I close the left eye. My patient looks at my right eye. I dot the center of her pupil. So once that is done, I will take off her glasses. So when you take it out, you can take the measurement from dot to dot. That's from the right dot to the left dot, and we're having 68 mm. That is your binocular PD. So you can also measure your binocular PD using your patient's frame and using this method of dotting. Now, this is your binocular PD. So let's get our monocular PD. For our right monocular PD, we measure from the right dot to the center of the nose bridge of this frame. And from the right dot to the center of this nose bridge is about 36 mm. That is for your right PD. So how do you get your left PD? You just simply subtract the 36 mm from 68 mm, which is what we got as the binocular PD. So for the next method of measuring the monocular PD without the glasses is simple. You measure your binocular PD first. Secondly, you measure the distance from the center of your patient's right pupil to the center of her nose bridge. So you know how to measure the binocular PD already. So if you haven't watched that video, you can watch the video where I taught you how to measure the binocular PD. So let's measure the right monocular PD. Same method. I'm seated 40 cm away from my patient. We're at the same eye level. My patient is looking at my left eye while my right eye is covered, and then I measure from the center of her right pupil to the center of her nose bridge. So that is that about monocular PD measurement. But always cross-check your markings before you take away your PD rule or before you take your final markings, because there are times your patient's gaze may change. So if that happens, you're not going to get an accurate reading, or you may probably get variable readings. So always make sure that you cross-check your markings by closing the right eye, your patient looking at your left eye, and vice versa. That is how you cross-check your measurements. So in the next video, I'm going to be showing you how to measure the near pupillary distance.